Financial problems at the Southern District Health Board are nothing new, but Richard Thomson knows that more than most. He's been on the board since 2001 as a chairman and a member. He's now a Deputy Commissioner and he joins us to explain the difficulties involved in running the organisation. Good evening.
G'day.
How long has the board been under financial stress?
It's been under financial stress ever since I've been involved, even although the boards merged several years ago. The Otago DHB, when I first came on back in 2001, had a combined deficit position of somewhere around $40 million, so it's not a new situation.
Did that situation ever improve at all?
Yeah, it did. Over about 7 or 8 years, we got the deficit position down from slightly north of 40 million to around 10 million. And then when the two boards merged, it continued to improve, I think, the first year. But over the last 2 or 3 years, it's headed north at a fairly rapid rate.
And what is it at the moment?
We're looking at around a $27 million deficit for this financial year.
How have things changed for the board in the time that you've been there?
Well, obviously a major change has been the merger of the Otago and Southland boards, and that was, I think, a necessary thing. It was a difficult thing, but it was a necessary thing. Even combined, we have a small population for some of the services that we provide, and so that's been a significant change.
Was it a sensible change, do you think? Has it made things worse?
It's been a difficult change because when you bring two different cultures together and you put a geographical distance between them, it's not easy. But it was necessary because together we had some strength. Individually, we simply didn't have the population numbers to sustain quite a number of the services that people have come to expect that we'll provide.
Is the SDHB under any more financial stress than any other DHB?
Yes. We are about half of the total deficit in the country, but we're about 10% of the total spend, so to that extent we've got a bigger problem than anywhere else.
Why is that?
Well, that's a very good question, and that's part of what we've been charged with answering, and I think that's important to understand, that the Minister's made it really clear that he wants this team not to go in there and slash and burn and look for quick fixes that won't be long-term fixes, but to really try and understand why we're in this position and what we need to do to manage our way over it over the long term. And so that's exactly the question that we're charged with answering. Is
it simply a case of not enough government funding?
I think if you start from that premise, you don't actually ask the questions that you need to ask. Fundamentally, what we need to understand is what we're doing being done as efficiently as it is anywhere else in the country, and is it being done for the right number of people? If the answer to both of those things is yes, then funding is an issue. But if the answer to any of those things is no, then it says we've got to do some things differently. So yes, funding may be an issue, but we can't start from that perspective.
What do you think needs to happen for the board, if it still exists, to be in, or will exist in the future, to be in a good position?
I think that we've got to look really hard at the way in which our services are structured, and we've got to understand what's driving some of the problems that we face. Now, some of those may be solvable, some of them in fact may not be solvable, or they may not be politically solvable, but unless we know what they are, we can't do anything about them.
Tell us about how the new management team will work.
Well, it's a new governance team rather than a new management team, but I think the essential difference between how the board functioned and how this team will function is, firstly, it's 4 people, 3 with another to be announced, and we're being asked to work much more like an executive director. In other words, working alongside management, working with them to find solutions, as opposed to being a traditional board that might meet monthly and that management would report to.
What are you hoping to achieve as Deputy Commissioner?
Look, I'm hoping to achieve some long-term understandings and answers, and I think that we've been so focused on the short-term deficit management over the last few years that the work that's needed to be done to look at those long-term things hasn't been done, and that's really what I would hope to achieve in my role.
Deputy Commissioner of the Southern District Health Board, Richard Thomson, thank you very much for your time.
You're welcome.